Good morning, everyone. Apologies for the delay in starting. We were trying to get Joyce to log in. Karibuni sana. My name is Dr. Theuri from KHF. We had a delay in starting because the other side had also not ended. Uh, we'll try and keep this to roughly about an hour 10 minutes so that the trainers are also able to catch a break. Today will be back to back for them, so I will request your understanding on that. I indeed am aware that there are also quite a number of questions that could come up out of this, so we'll try our best to clear them up as we move. The other one is we are also trying to have sort of like a case manager in one of these trainings, so that we are able to answer the questions in a more in-depth manner from the SHA side. That being said, karibuni sana, and over to you, Joyce Wamishwe.
So thank you, Dr. Theuri, and good morning. And for those who have jumped from the other session to this session, karibuni tena. Just give me a minute. I make sure the team that we need to talk to, us is on call, so they can also be promoted as panelists. Just give me about 2-3 minutes. Thank you. Okay, so I think we can start as I try also to get someone who is going to speak from the user perspective. So my name is Dr. Joyce Wamishwe and I work at the Ministry of Health. And as indicated in past similar kind of update trainings, we want to update the facilities on the SHA claims portal. We have a version now that is enabling pre-authorizations and claims processing and submission. This is still work in progress, lots of work in progress, but we appreciate any feedback because that is what makes the next version even better. As I keep on saying, this particular portal is an interim measure. Given that the best case scenario would be facilities having an end-to-end hospital management information system that includes the billing or the claims module, and a lot of these functionalities happen automatically. So for now, because lots of our facilities are not digitized, or if digitized, it's not end-to-end, that is why we have a portal. So this portal is supposed to do 3 things: enable you to do client identification and ascertain their eligibility to receive services under SHA. Secondly, it's supposed to help you raise pre-authorization claims where necessary. Then thirdly, it's supposed to help you do the claims processing and submit. This portal, a lot of like when it comes to the client identification, it's really pulling from the SHA registration. So somebody must first be registered in the SHA registration portal for this portal now to get their details. So over to you, Doris. You introduce yourself. Doris and Linda, you'll decide who does what. Introduce yourself, and based on the issues that keep on coming up, preempt them even as you present. The second thing I have continuously requested is in the chat, could we please put the test credentials so that people can tinker. I don't know a better word for that, but tinker with that, with the test portal, with the portal in the test site, so that they are able to move with you. We are able to move with you as you take us along. Thank you. Over to you.
Good morning, team. My name is Linda, one of the support team. With me is Doris Mwende as well from support. So Joyce, the credentials in a few, it will be ready. As Doris Mwende is presenting, I am following up to ensure this has been done. So kindly, if you allow me, Doris.
Thank you, Linda and Joyce. Good morning, everyone. My name is Doris Mwende. I'm from support. I'll be taking you through the presentation today. In case you have any question, please put it on the chat. My colleague Linda will be responding, and we'll also maybe have a short session of Q&A where we can allow a few people to ask live. To save more time, please put your question on the chat, and I think we can start now. So we have been creating credentials for hospitals. In case you've not received your credentials, also let us know using the chat box, the name of your facility, MFL code, and your email address, your first and last name, so that we follow up on that. We'll share the login credentials using the email or via the email that you've shared. And we'll also share the login URL. So the login URL is portal.sha.go.ke, portal.sha.go.ke. And once you've loaded that URL, this is the first page that you will see. So this page contains a link. We have a button here that has been written Learn More. When you click on this button, it will direct you to the Social Health Authority website, and you can learn more. You'll find ways of registration there, what benefits are, what is covered, to just educate yourself more on Social Health Authority. So if you click on this Learn More button, it takes you to that website. On the same page, we've displayed the customer support numbers and the email. So this is the number. It's a toll-free number. You can use it to reach out for any assistance, as well as the email, which is customerservice@sha.go.ke. So you can use the two to reach out for any support. So I'll proceed to the login button. So you'll click on login. And once you're on this tab, this is the login page. So you'll use the email address that has been shared to your email or that has been created to log in. And just in case you'd like to reset your password, this is the same screen that you use to reset your password. So just below the login button, there's a reset button. When you click on the reset button, the system will prompt you to type your email address. So this is the email address that has been created, and you'll get a link sent to your email address for a password reset. So we'll give you instructions on how to reset your password. So in case you'd like to reset, you click on the reset button, takes you to this page, enter your email address, click on reset, send reset link. We'll send instructions to your email address, and you'll be able to reset your password. So I'll click, go back to login. So I'll log in with my credentials. Click on the login button. Okay. So I've clicked on my login button, and what you see is the login page or the home page. And please, in case my screen is not visible, let me know. So on the login page, on the far up, the blue button, the blue tab, towards the right, you'll see the name of your facility, and we have the help button. So the help button, don't know, I think my screen is not visible. Sorry, allow me to share again.
Yeah, perhaps you can share entire screen.
Um, Sorry, just a minute. I'm sharing my screen back. Apologies for that. I believe everyone can see my screen now. So this is the home page. After you click on login, this is where the system takes you. We call this the home page. So on this there's a blue tab that is running across your screen. So towards the right, we have the help button. When you click on the help button, we have the displayed support number and the support email address. In case you want to reach out, please use the two. Then we have the download AnyDesk. So AnyDesk is an app that can help a user remotely access your computer, just in case you need that kind of help. Then next to it, we have the test provider. So for you, it will show the name of your facility. So please confirm to make sure it's showing the correct name. Then next to it, where I have my test share user, that will be your first name, your last name, and the location of your facility. And in case you'd want to change your location or log out, this is the button that you click. Then you get the two options where to change your location or to log out. Then just below it, we have the help button. Again, if you click on it, we've displayed the support numbers and the support email. So you can use the two. Then next to it, we have the start tour button. When you click on it, it shows you it's like a navigation tool or a guide that will show you the different sections and what they mean. So you can quickly refer to the start tour here to just get clarification on the areas. So I'll go straight to the test member. So this is the eligibility lookup page. So we can search using the ID and the phone number. For now, we'll start with the national ID. So you'll request the member to assist or to read the national ID to you. So I'll use this as my test patient. Then I'll click on the lookup member button. This is a blue button, lookup member. So when I click on lookup member, it will give me the details of the member that I'm looking for. You can see there's the name, there's the ID number, the validity status, and towards the far right, we have the view button, the action view button. So we want to view this member so that we can see the eligibility information of the member. So you'll be able to see the name of the member, there is a gender, the date of birth, a SHA number, the relationship, and if this is a dependent or not, or a principal or not. If this member is not a principal, where we have a yes indicated, you'll have a link. It's a link that you can click to access the principal member. As I scroll towards the center of my screen, you'll see the eligibility status of this member. So for example, for my member, you can see there's a reason why that patient is not eligible, and you can see the solution. Now, we also fixing the registry so that we can update, make sure that it's up to so that all the employed members, we show the badge. So this is like a badge to show you more information, and will give you the reason and the solution. So for example, this member has not paid up, maybe advise them to pay, just different reasons, and it will be case by case for the different members. I'll scroll to the bottom part of my screen where I have packages. So on the left side, I have my packages. On the right side, I have dependents. So if I'm looking to view the dependents for this specific member, I'll click on the right button, that is a dependent button, and it will list me all the dependents that have been added for this specific member. So you'll see the name of the dependents. So if there are 2 or more, you'll see all of them listed. Then you'll see the SHA number, you can see their date of birth, the relationship to the principal, could be a child, could be a spouse, and there's an action button called view, where you can click and view the dependents details for that principal. So allow me to go back to packages so that now we can admit or start a visit. So we have a search button here, which you can use to navigate through the different packages. I'd like us maybe to start with an outpatient visit. So I'll go to outpatient. So for outpatient, we have these services. So we can do the first renal package, for example. So you can see the fund could be SHIF only, PHC only, all SHIF and PHC. Then the access points, again, could be outpatient and inpatient, or just outpatient or inpatient. So it will depend with the package that you're selecting, and we'll show you that information. So we'll show you that information. So I want to click on this action button called View Intervention that is on the renal package. So I'll go to the right side of my screen and click on View Intervention. So I'll see the different interventions for the renal package. And you can see these are available for both OP and IP. So allow me to use the hemodialysis one. So I'll navigate to the right side of my screen, and before you get there, there is the button for pre-authorization. So if it's yes, it means that that specific intervention will require you to seek for pre-authorization first before you offer services. So I'll click on select intervention, then I'll scroll up and I'll see my intervention. This is the intervention that I selected. And the system will request me to specify whether I am the dialysis is for outpatient or inpatient type of benefit. So in our case, we could say it's outpatient, for example. So your intervention will be listed here. We can see now the access point that we've selected is outpatient, and it still requires a pre-authorization. So I'll take you through the pre-authorization shortly. And if we want to click on this button, so for me, it's continue visit. It's a good thing that it's continue visit. So what this means is there's an already active visit for this member. And for the training purposes, allow me to just complete or cancel this visit for my member, so that we can proceed with this illustration. Maybe my colleague Linda can answer a question first as I cancel this visit.
Pardon, what was the question asked? Sorry.
Okay. So I go back to my patient, my test patient, lookup member. We have the details of the member displayed here. I'll click on view, I'll see the member eligibility. Scroll down to the packages. We were working with outpatient. So we choose the renal package. We can see the fund that has been displayed there and the access point. We want to navigate to the right and click on view intervention button. So we'll have the interventions listed here. In our case, we want to go with hemodialysis. So I'll click on select intervention towards the right, and we'll want to use outpatient. So once I've selected my intervention, I'll slightly scroll up and select the type of benefit. This is for those that have would have multiple access point. If it only has one access point, will not need this step. So you click on outpatient. Now you can see my selected interventions. I have hemodialysis, access point is OP, pre-authorization required. Still have mine as continue visit. Okay. So let me just correct that quickly. Patient. Hemodialysis. Outpatient. Okay. Maybe Linda, you can assist me with another ID that I can use for illustration.
You can use mine.
Okay, thank you. Yes.
30,
30,
34,
34,
34, 1999.
99. Okay. So 30, 34, 34, 1.
No. Just remove the 34. The 34 should be 1. 34, yeah. 30, 34, 1999.
Right.
1999.
Right. Let me use this test user instead. We'll just use the same package. Outpatient. We use the renal care package. We use the hemodialysis outpatient. Oh, Linda, we also need to close your visit. So
You can use Christine's.
So actually what this means is that there's an ongoing visit for this specific patient, and I want us to start a visit for a new patient. So let me see.
You can use Christine's.
Okay.
33, 25, 23, 60.
Okay, we use the same. Go to hemodialysis, select intervention, outpatient. Okay. So minute.
Anyone can volunteer. We can just use things. I don't.
Linda, if you're done, we can pick the Q&A questions.
Yeah, I think we can pick a few questions as we get.
So just go to the Q&A part quickly. So the first question is, how do I change my location? Because it shows my main location. I don't want to assume this is someone with a branch.
Okay, so in case you have multiple locations, we'd need to know that information so that we can map your email to multiple locations. So if you had not given us that information, we could use the same form that we were using for onboarding, and then we get that information.
Now, how can someone raise that ticket for a change of location?
So we can use the email address that has been displayed there, or we could use the onboarding form that has been circulated. But please, you can share your email address again on the chat, and we can reach out after this to assist you with the change of location.
Crystal Care. Their name is appearing different as a different facility. How is that corrected?
So for that, we are still using that onboarding form. So you'll indicate
submit it
that.
again.
Yes.
They submit it again.
Yes, now you submit it with the reason or the indication that you're requesting for correction of the login credentials.
All right.
And then
yeah, we do have, they've dropped, I think, their contacts on the chat. Please pick it
all
up.
right. Thank you.
Determination of what type of patient can be treated as an outpatient under level 4, and how do you know that your level 4 is among the PHC select for you to offer patient services to our clients? Unless the information has changed, what I am aware of from the meeting we had with the SHA board, select level 4 facilities will offer PHC, and this is the prerogative of the SHA board from what we were told. This list, I am not sure whether it is out, but I have not seen it anywhere. I have not seen that list anywhere. So at the moment, I am not sure of a way of doing this. Perhaps we can get guidance on that.
But Dr. Theory, what the expectation is that as once the system, I mean, because it's work in progress, once the login credentials will match even what that particular facility will see that it should be able to offer. So
Awesome.
yeah, so all that will be, we want as little thinking as possible when using the system. So those things will show up when our facility logs in, and then they'll be able to know that they can offer this and not offer this. But it's
Great.
working progress. Thank you.
I know for sure there are some access rules on the system that are being worked on regarding things like what Joyce has mentioned, rules for age and gender. This will be worked on over the weekend, so perhaps on Monday we'll see a more significant update pushed into the system. On eligibility, this is by Harriet. Since for employees it is saying that employer by product is not submitted, does it mean the employed persons can only access services next month once submissions have been made to SHA?
So for that one, it is for all of us, it's like that. But SHA was supposed to and should have done that by now, indicated to the system that for this month, we are all to receive services because it's this month's payslip that will be cut. Now, I mean, then now we start paying the premiums. But for this month, the understanding is we are all eligible, but the system should be programmed to that. And that's something we already raised a few days back. Should be sorted out.
Right. What is the mode of payment for self-employed members, and who? And I think this should be how much should they pay?
So for self-employed, when you go to the web portal afyayangu.go.ke, or even if you use sha.go.ke, it still takes you to Afya Yangu. Then the minute you indicate you're self-employed, there are some questions that come. That is what is called the means testing. They tell you how much to pay. So after that, there's supposed to be a message that automatically pops up, and you are then requested to now put in your PIN. But the understanding, I think I had somebody from the other training saying that you can also use the 222 thing, but you have to start from the web portal to be able to know how much you're supposed to pay. That is for self-employed.
All right. The other thing is the M-Pesa prompts are not going through. The M-Pesa prompts are also not going through. Joyce, any comment on that?
No comment on that, but I have escalated it already based on the previous training. Yeah.
Okay.
Just...
When a client pays for SHA, it is reflecting on NHIF and not SHA. That is by Salome Masharia. Any clarification?
That one is a new one. I have had it today, so I've already picked that up and escalated because it's supposed to show up on SHA, not NHIF. And whatever was in NHIF extra is supposed to be moved to SHA.
Okay. For PHC, can we offer services to registered members and not paid up, or they have to pay annual premiums? The prompt SMS for payment of premiums for self-employed, the clients are not getting them to pay. This is by Abanas Mutisia. I don't know that it's clear.
Yeah, yes, it's clear. It's a similar problem to what has been raised. That whole self-employed and what they need to pay and how to pay is before then this particular training, let me get clarification on that. Because for me, when I saw it, there was supposed to be that prompt. So I'm wondering what is happening.
Okay. Silas Njeru is saying that his login credentials had been attached to a hospital he worked before. He raised the ticket 4 days ago, still not much of progress. Kindly assist him. He is on the chat. Please assist him. The claims portal requires you to add billing/invoice items at admissions level. How is this possible when one does not know how long the patient will be admitted? Also, if I invoice initially 5 days and the patient is discharged after 3 days, do I claim by 5 days and vice versa? Second, medical cases are paid on per diem basis. So if I invoice more, will I be paid more? Invoices are done retrospectively, not prospectively. That is by Harriet. Any comments on that?
Yes, I can answer on the items. So
Okay.
once you've admitted the patient, which I'll show you shortly, you'll bill at the point of discharge. That is when you'll know how much or how many services that you've given to your patient. So the bill items, you don't add them at the point of admission, but you'll need to send a pre-authorization first, then the billing will be done at the point of discharge. So I'll show you that shortly. Then
All
for
right.
the credentials that you are issued credentials for your previous workplace. So please use the same form and request for correction of the facility, and we'll get back to you. But I've also noted your details on the chat, so I will fast track that.
Asante. Someone is saying the son's gender is appearing as female. That I think is just you'll give a comment as you also answer the following question. Enoch is asking for a full demo on pre-auth of medical cases, like for level 3A facility. So as you're doing the other demonstration, you can do this one as well.
Okay.
How many login accounts can be created?
So we can create multiple login credentials if there are multiple requests and for valid email addresses. So make sure your email address is valid, because now if you give us an email that is not valid, we'll try to create and they will bounce back. So ensure that it's a working valid email address. So if there are multiple users, then they all have valid emails, then we are able to create multiple login credentials.
All right. Someone is admitted at Nairobi Hospital and they're being asked to pay bed rebate. Any comments on that?
That one, I have no comment for that for now.
All right. Can you please pick it up so that we know how to answer it? Because I think this is the name looked familiar from what I could see, but let's see how we help with that. Are there SHA claim forms and pre-auth forms, and how can we get them? Are there SHA claim forms or pre-auth forms?
So in terms of pre-authorization, the idea is that everything happens digitally. And though there is a question that we've raised again back to the SHA operations team, because there's a gap. So initially we had all these forms, claims, pre-authorization forms. Then along the way, it was indicated that a lot of this will be done digitally. But as you can see, even in this system, there are things that we need to attach as evidence. So the question back to the operations team is, can they give clarity on this? Yeah, so that is something that we've already picked up and forwarded to Director Hazel.
All right. My proposal will be in the 3 p.m. In the 1 p.m. one. Let's have someone from the operations team on SHA so that these questions can be answered.
Yeah, we are even supposed to have, even right now, let me just follow up and find out.
Okay. All right, our hospital is showing level 2. Now this one is an anonymous person. It will be difficult to help. Please ensure you have your name on the chat so that we know what to do. Assist with the credentials for MFL code 12972. Please note that down and get back to John Otieno. And then as you're doing the other demonstration, do the demonstration for maternity journey from eligibility verification through to ICD claims in primary healthcare facility.
Okay.
Yeah, thank you. For level 4, how do we see working clients? I think this has been clarified previously. And then a spouse added is showing up as a child on the SHA profile. How do we correct this? I think this also came up in the morning. Then there are a couple of questions on the phone number. How do you change your phone number? Please give comments on those. So when a spouse is appearing as a child and the comments for the phone number, how do you change the phone number?
Okay. So for the phone number, we'll use Afya Yangu to change the phone number. Once that has been updated, we'll be able to pick it on the portal. Then for the spouse, who I believe it's when you click on dependents, the relationship to the principal, it's maybe reading child instead of spouse. So we'll correct that for you. What we can do is maybe you can share an email or a way I can reach out to you after this via the chat so that we get that sorted.
All right. Great. Phone numbers you've said. There's also one on it's a level 4 facility, but it's showing as a level 2 facility.
Okay. I would also like to have an email address so that we can correct that for you. So the name of the facility, MFL code, and maybe your email address and a phone number if possible to reach out so that we confirm it's okay. So my colleague is noting all that information from the chat so that we can action immediately after the meeting.
All right. So once you've actioned, could we, just drop for me the action so that I'm able to give the providers in the group so that they can assess progress.
Yes, yes.
Thank you. Uh, advice on the civil servants scheme because the letter was received in different facilities. There's a letter received that it's active till 21st. We serve them under which package? I think this is being done end to end under Hicks, unless that has changed. Please confirm if I have said the truth.
It should be under Hicks because SHA does not recognize enhanced schemes.
All right.
Okay.
Urbanus, Mutisia says his PhD question has not yet been answered. How can you attend to a registered client who is yet to pay premiums? I think that is his more specific question.
Okay, so the registered client who is yet to pay premiums, is the registered client a pregnant woman about to give birth? That's a bit different because that one you attend to them and ideally under Linda Mama, such a person should be covered. But if it is any other way, then you want them to pay the premiums for services that are supposed to be claimed under SHIF. But if it's services under level 2 and level 3, as long as someone is registered, then they should be able to claim for those services. I hope that's clear.
Okay. Is it possible to edit the means testing once it's been submitted?
No, not really. But what should be coming up in the next iteration is a window to say, hey, I don't agree with what the means testing has said about me. And then there is that kind of conversation that carries on in that particular window. But for now, what you see is what ideally you should pay.
All right. I do hope that we have the team noting the questions in the chat so that we can have feedback and good turnaround time.
Yes,
For
yes,
level
sure.
5, okay, thank you. For level 5 on the fund, do we offer services to patients only under SHIF and PHC or on what fund? This is by Faith. I think they will be dealing with the cases that have been referred. Any outpatient service will be cash basis. However, if there is an inpatient procedure, then the SHA benefit will crystallize. Jace, have I said the truth?
Yes, you are spot on. And then
All right.
also, as I said, the system, once you log in with the proper credentials, the system will already like tell you for this particular facility, this is what you can do, this is what you can. You shouldn't have to be thinking that this one is going to come from SHIF or what. It's there.
Okay. OTP for an unconscious patient, perhaps an emergency, and they are without their phone. What happens?
There is a place where there are two windows, and I think Linda and Doris can take us there. There is one where it's OTP is me and my phone, but also the provider. There's a place where you can get authorization from somewhere else, not the actual person. If I can recall.
That is correct,
Doris, you can take us through.
Yeah, that is correct. I don't know, Dr. Theory, maybe we can
I
also
suggest we do that now.
Yeah.
Because we have another session that is coming up. The questions are still coming in fast and hard.
Yeah.
The truth is, we may not be able to catch all of them in this particular session. We will try in the next as well. My appeal is that whatever questions have been asked, I hope we've noted them down so that we're able to give like a comprehensive document with those answers a little later.
Okay.
So please proceed, and once done, I think we'll bring the meeting to a close so that we're able to get ready for the next one.
Okay. So allow me to proceed. So we were working with the outpatient benefit. So let me select again. Let me go back to the renal package. I'll select view intervention. Then I'll have different interventions that I can do for that package. So we work with hemodialysis. So I'll click on select intervention, and then I'll have to select which of the two benefit that I want to start that visit or admit against. So let's choose outpatient. Then we'll see these are my selected interventions. In case that patient would need more than one intervention, you're allowed to select multiple interventions at the same time. So for a patient, we want to start a visit or admit. So I'll go straight to this button, the blue one, and click start visit or admit. Then it takes me to this pop-up where I have the name of my patient. So please confirm you indeed like to create a claim for this specific member. You'll see their number here, and you'll see the listed interventions that you selected, the access point, and if they require pre-auth or not. Then just below it, we have different ways to verify the member's identification so that we can admit. Now we have two ways at the moment. One is using the OTP, and the other one is using the pair authorization. So if it's the OTP, we'll have the listed phone number just below it. So we've masked the numbers for privacy reasons, so you'll not be able to see the full number, but you can quickly ask the member if the number ending maybe with 433 is their contact. If that is their contact, what you do is you go to the action button used to authenticate. When you click on that button, the member will receive an OTP. An OTP is a one-time PIN that will be sent to the member's phone number. So you request them to read it to you, and you'll be able to open that visit. Now, before we open the visit with the OTP, allow me to talk about the pair authorization button just next to the OTP. So in case you've not been able to open your visit, oh, sorry, it's taken me back. So in case you're not able to open your visit using the OTP for any reason, it could be the member doesn't have the phone number, the phone at that time, their phone is off, it's an emergency, the patient was brought unconscious, among other reasons, you can use the pair authorization. What it does, it will allow you to admit the patient, but you'll not be able to submit the claim pending approval. So the approvals are very fast. The SHA team will assist us with the approvals, and then you proceed. So what you're needed to do is we'll choose your location. So in case you have multiple locations, but first it will select the location that you've been allocated to. Then there are reasons for the request. So we have a couple of reasons here. So you select the one that is appropriate for you. For example, we could say it was an emergency. Then you need to write a note. So this note is what explains the reason above. So you can say maybe the patient or the member was unconscious, maybe at the time of admission, that's why maybe you're not able to open or the visit, or maybe the patient didn't have their phone, etc. Then we'll request you to attach a supporting document. So a supporting document could be a patient ID, their membership card if they have one. It could be a report written by the doctor, just any document that will actually support your reason above. So you click on choose files. Upload. So we allow two types of uploads. That is a document type, could be a PDF, or if you've taken an image, a JPEG. So you'll be able to upload the two. Choose file to upload from your computer or from the device that you're using. And then you click on start visit. It will open the visit for you. So in our case, let me just go back to OTP. So the OTP, you click on use to authenticate. That is the button, the action button there, and request the member to read the OTP to you. So let me check my OTP that was sent to my phone number. Okay, so it's, and in case it takes too long, you can resend the SMS. So there's a button that appears there, and you can resend the SMS to the patient. So this is the SMS that I got, and I'll go ahead and click on verify one-time PIN. and for that visit to open. So in case you have an OTP that is not valid, the system will alert you that that OTP is not valid. So at this point, you've already admitted your member or your patient. Maybe they've gone to the ward or they are receiving dialysis, etc. Then the next step would be to first, if there was a pre-authorization, first before you give service, you request for pre-authorization. So let me first explain what you can see. We call this the billing page. Towards the right side of my screen, we have the start tour. This is a button that helps you understand the different parts of this page. In case you'd want more clarity, you can click on a start tour. It will just briefly give you information on all these items. Then next to it, we have add intervention. Now you could have admitted a patient and then along their treatment journey, there is need to do more interventions. So you don't need to open a new visit. You can click on add intervention and then search for the different interventions. For example, this patient maybe might require an MRI or etc. So you can add your interventions here. The next one is complete claim. So we'll use that as we are complete on submitting. Then here we'll have the different items that are required to bill this, for you to complete this claim. Then just below it, we have this reference number. So this reference number is very unique for each visit, for each patient. In case you need a number to track the patient throughout, you can use this reference number. So this will be unique for every patient, for every visit. Then below it, you'll see the name of your patient. You'll see their number. Next to it, there's a date. So this is the admission date or the start visit date. Then below it, it's pending because we've not submitted it. Once we've submitted, it will be submitted. Then we'll have your location here and the service type. So ours was outpatient. In case it was inpatient, you'll see inpatient. Then the auth status. Now the auth status shows the method that you use to start or admit the patient. So in our case, it's authorized using OTP. If we would have used the pair authorized button, it would read pair authorization where we have OTP. And if it has not been approved, it will still read pending. When it's approved, it reads authorized. Then we have amounts here. So these will populate as we bill. I would want us first to go to the pre-authorization. So to get to the pre-authorization, you scroll to the center of your screen, which where we have the intervention that we selected, and we can see it requires pre-authorization, and we'll show you the allowed amount of the tariff. For this case, it's 10,600. So scroll down again. We'll show you more information about that package, coverage level, fee for service, allowed limit per year. So you'll see all that information. So just below it, now we have the pre-authorization. So if we alert you that this pre-auth has not been sent, so you click on the button that is on the left side, on the right side of my screen, named as create a pre-authorization, so that now we can first submit requests for this specific patient. So when I click on that button, which is the pre-authorization button, it will create pre-authorization form for me. So what I need to do is open it. And to send a pre-authorization, we'll need to do 3 actions. 1, we need to indicate the diagnosis. We'll need to indicate the amount that we are requesting or that we are seeking approval for, and we'll need to do an attachment. Now, as Joyce had mentioned, we are working to ensure that we'll have digital forms, or will not need maybe forms, that is in the near future, where we can even maybe try generate a form for you. But for now, we'll need an attachment. So I'll start with the diagnosis. So you'll select the diagnosis that is applicable for your patient. So for me, I'll just select any. Oh, sorry. So for me, I'll select any. Let me go back to my diagnosis. Let me just select a random one, for example. And if you need to have more than one diagnosis, the system will allow you to add multiple diagnoses. You can edit, you can delete your diagnosis before you submit. Then for this specific intervention, which is hemodialysis, we already have a tariff for it. So you'll find the amount has already been filled for you or keyed in for you. So you could edit if there's need to edit, but we'll just have it already there. For other services that there might be, there's no set amount for it, you'll have to key in your own amount. So I'll show an example of that. Then we'll proceed to the attachment. So where we select a file to upload. So let me select a random attachment from my computer. Then I attach it, and then we submit this pre-authorization. So select file. It is my attachment. Oops. So touch. So once you've done your attachment, what you need to do is you click on submit pre-authorization, and that pre-authorization will be submitted. So once I've submitted my pre-authorization, you can see it's active. Active means that it's pending approval, but you've already submitted it. So the approval process takes about 5 to 10 minutes. So do not be worried that this might take long. You'll get your response very fast, and you'll be able to advise your client appropriately. So once we've sent that pre-authorization and it's been approved, now you proceed to give services. And if after the patient has been, you've given all the services and you already know how much you're charging or what to bill for, then now that is when you proceed now to the claiming part. Now for the claiming part, we'll need to do 3 actions. One, we add the billing items. We'll need to select a diagnosis, that is the overall diagnosis, and we'll need an invoice number. So this patient, let's say this patient has already dialyzed and they're ready now to go. So you'll now come to complete your visit. We'll start with the invoice number, which is on the upper side of your screen. So let's say a random invoice number. Then you click on save. So once you've saved your invoice number, then we'll scroll back, and okay, our pre-auth is active still. So we'll go to the diagnosis part. When you click on the diagnosis, we have 2 ways of adding your diagnosis. One, you can add by name. The second one, you can add by ICD-10 code. And if you're not very sure of the ICD-10 code, we have another button here. It's search on website. If you click on this button, it takes you to, it's a website where we have the ICD-10 codes. And if you're not sure, you can just type your diagnosis there and it will give you the code. So for my explanation, I will just use by name. And in case you had selected different interventions, so you'll add the diagnosis depending with the intervention. So if I had selected maybe multiple, I'll find them listed here, and I can say this diagnosis is for this intervention. Then I save, then I'll add another diagnosis for maybe my other intervention. Then after I'm done with that, I'll go to billing. So billing is the last option on our page. So when I click on billing, I'll see the invoice number. This is the invoice number that I saved above. Amount. So I still don't have any amount that has populated. We'll first need now to add our items so that we have the amounts populate above. So we have this button. It's add patient contribution. in case there's any copay or any contribution that the patient is making. This is a button to use. If you click on it, you'll be required to say how much maybe the patient contributed, could be 200, 500, 1,000, etc. And then you click on save. Then I will come to adding the item. So we have this button or this space where we are searching for the item. So you click on that space. So when you're starting to use the item, to use the system, since you will not have billed any item, you'll be required to add these items to your price list. So every time you're billing, they'll keep saving to your price list, and you do not need to add them as a new item for any other patient or any other visit that will need that item. So for example, you see for my training instance, these are some of the items that we've billed, and you can see they're already listed here on the price list. So if I'm billing, for example, Brufen, I'll just select it and I can see the intervention for which I'm billing that item for. Then I'll see the price and the quantity, the discounts. In case you're giving discounts, this is where you indicate. If not, you'll just proceed to save your item. So you'll add all the items that you've seen or all the services that you've given for that patient. So let me try add an item that I have not saved before. So for example, it will appear like this. So you need to add it as a new item to the price list. So this will also save the item to the bill. So I'll click on that button, then I'll say maybe I'm giving maybe just a service, maybe don't know, is such a service, but yeah, just a random name. Then the price could be, for example, quantity, if there is any discount, etc. and save. So that is how you add your items to the list. So you'll need to itemize your items. And you can see they've been listed here, the date, the item, the price, the quantity, the total. You can edit and delete or delete as long as you've not submitted. So let's say these are the two items that we want to bill. Then we'll need now to attach to have an attachment here. So you can scan in case you have an HMIS and you're able to get a PDF copy, you just download it and then you attach it here. So let me just do an attachment, for example. And once you've added your attachment, then you can submit. Now we have two ways of submission, or two buttons for submission. One is at the bottom of your screen and the other one is on the upper side of your screen. So you can use either. And as you can see, our amounts are already here. In case I had added the patient contribution, then the net amount will be this amount minus the patient contribution. So what we want to do is we click on review and submit claim. Now, in case you've not added any requirement, it will alert you at this point. So you can see your claim information, you can see your diagnosis, you can see your invoice information. So for me, it tells me that I do not have an attachment, which I should go back and attach. Once you're sure this is what you want to submit, we have a button here that you need to check to actually confirm that you've submitted, or you've confirmed that this is the required information and that you're ready to submit. So if you want to go back and edit your claim details, you click on this button, which is edit claim details. Otherwise, you complete and submit your claim. So are you sure you'd like to submit this claim? You click on yes, and then that claim will have been submitted to SHA. Now, once you submit, it takes you to this page. This is the claims page, and we have different tabs here. The first one being the pending tab. So this pending shows all admissions or visits that you've started. but you've not submitted or you've not completed. Then under sent, you'll see all the claims that you've submitted. Then under closed, you see the claims that you've closed and all. So by closed, for example, you could have opened a visit and for one reason or another, you do not want to submit this visit. Could be for many reasons. For example, I could just open a random one here. If I click on view, it takes me to that claim. And when I scroll to the bottom of my screen on the right side, we have this cancel claim button. So when I click on this cancel claim, I'll have to select different reasons as to why I am canceling this visit. Could be you started for the wrong patient or no service was given, wrong benefit, etc. To select your reason, you'll do some math here and then you click on cancel. So that cancels that visit for you, and then you can start a new one. Yeah, then you can start a new one. So that is how you cancel a visit. So in case a patient has an open visit, you cannot open another visit for the same benefit unless you've submitted your existing visit or you've closed it. So that is what closed means. Then I'd like to talk about the authorization button too. And before I go there, we have these other buttons here, which is view authorization and filter. So for the filter button, in case you'd want to filter your maybe pending claims, so that you, maybe for the purposes of just knowing which ones have not been submitted and which ones have been submitted, you can filter and then export them in form of an Excel. The same with authorizations. We'll see the pending ones, the authorized ones, the rejected ones, the closed ones, and all. Again, pending ones, those that are waiting for approval, authorized, already authorized, etc. Then when we go to pre-authorization, we'll see draft pre-authorization. So for example, if you had started a pre-authorization process and you've not completed, we'll consider that as a draft. Once you've submitted it to KHF for approval, that is an active pre-authorization and you can check them here. Once it has been approved, it will be under finalized. And in case you started a pre-authorization and you didn't want maybe to submit it for any reason, you can cancel your pre-authorization and then all. And again, we have the filter button where you can filter maybe for the location and date, etc. And then you can download those the that you get, or the items that you get from that filter. Yeah, so I think I've gone through, I can go through there was a request to go through the maternity case. So we can go through it very fast. So I'll use the same member. I'll click on look up the member, then I'll see the information or the details of that patient. I'll go to the action button view so that I can see the eligibility status of my client. I can see the gender, date of birth, etc. So I'll scroll down to the packages and look for maternity. So we have maternity here and you can see the different fund for it. So maybe I can use the request, I think was level 3. So we can start with the second one, which is I'll click on view intervention. Then you'll see the different interventions that have been listed here and if they require a pre-authorization or not. So antenatal care, no. Anti-D, yes. So you'll the system will prompt you to request a pre-authorization if it's yes. If it's no, you'll just proceed without. So let's say this child maybe has come for immunization. So I'll click on select intervention. So scroll slightly up. I'll see my intervention there. Then I'll click on start visit or admit. Then it takes me to the identification page where I can either use the OTP or the payer authorization. So let me use the OTP. I'll click on use to authenticate. Then it will send the OTP to the beneficiary or the member's number. Then let me check for my OTP. Okay, so this is my OTP 733173. Then I'll click on verify one-time PIN so that I'm able to start a visit for my patient. So for this visit, I'll not need to send any pre-authorization. So as you can see, there is no pre-authorization required. So after I've given my services, I'll go straight to billing. And to billing, I'll need the invoice number. I'll need the diagnosis and then the items that I billed. So I'll go straight to my invoice number. So let's say that is my invoice. And again, as you can note, the reference number is unique. So you can use this for tracking purposes or for record purposes. So I've added my invoice number. Then I'll scroll down to add my diagnosis. So this could be maybe immunization or sorry, just pick a random one. Then I click on save. Then I'll go to billing. Where now I'll add the services that I've given or any medication that I gave. Maybe, so let me, injection or a vaccine, any. If it's not there, you add as a new item. So we could say it's maybe polio vaccine. For example, how much did you charge? Maybe 500. For example, quantity is 1, discount, and then you click on save. So you'll just add all the services that you've given for that specific intervention. If you've given multiple vaccines, you include them there. And once you're done, we go to review and submit. Again, gives you a summary of what you've built. If you've confirmed that is the correct information and all the items that you needed to add, you need to check this box and then you complete and submit the claim, or you could go back to edit the claim. Yeah. So maybe I can take a few questions and see if there's something I need to go through again. Let me go to the chat box.
Thank you for that. I think we'll just take 2 questions. I think you've done medical cases as well, isn't it? For the demo.
Sorry, what? I didn't hear you clearly.
We've a demo for medical cases.
That is for inpatient?
I suppose.
Yeah, okay.
I thought she's handled that.
She's handled that. Yeah, that's what I'm saying. Yeah, that one you've handled.
Oh, yeah. Yes.
So I think I will allow us to stop there in the interest of time. Now, this particular session will be live on the KHF website. I think we've also done maternity admission, isn't it?
Yes.
Joyce, you've done? Yes. Okay. So that has been done to the person who's asked that on the chat. So we will have this on the KHF website for anyone who would like to refer back to the conversation we are having. Please do so. In the interest of time, and also to be fair to the 3 fantastic ladies who are taking us through the day-to-day, allow us to stop there. They have committed to pick the questions that have remained and send us some information around the same. I will be waiting on that, Joyce, Doris, and Linda, so that we're able to provide us with that information. For now, thank you for attending. Joyce, Doris, and Linda receive my sincere appreciation. Martin from KHF, asante sana for supporting the backend. Till the next one, asanteni, we will meet with the rest of the people at 1 o'clock for a similar session. We will endeavor our best to have someone from SHA on that one. Asanteni sana, and do have yourselves a good rest of the weekend.